So counterfeit medicine is this idea that medical care, as well as medical products and medical drugs or medicines, may not be what they're billed to be. And this is a conversation that I learned about 20 years ago when I spent time at the World Health Organization. So they had started that discussion a long time ago. And a couple decades later, I think we're still in this novice stage of understanding. When we talk about this topic to most people, they still are shocked and surprised by the depth of counterfeiting that's occurring. We're still seeing counterfeit medical services, counterfeit medical delivery, and I think it comes down to money. There's still money to be made, and as long as there's money to be made, there are going to be people who have cut corners, people who aren't trained correctly, people who are practicing outside their scope of practice, and then you're going to also have people who are not even physicians who are pretending to provide, top-tier medical care. So that exists, and it's very real, it's very tangible. It affects patient care, it affects outcomes, it affects their lives, but it affects the whole entire medical profession, because all you need is one counterfeit medical service, one counterfeit medical physician, one counterfeit pain physician to really ruin it for everyone. Because unfortunately, society and media wants to make examples of that one person and say, because of this one person, look at all of pain management is bad. All doctors are bad. All Western medicine is bad. All hospitals are bad. And it's really unfortunate. So the effects are devastating. The effects of counterfeit medical products are also just as devastating. So you can have an honest provider, a good provider, a great provider, a perfect provider, as close to perfect as least as they can get, providing the best services that they can provide. But if the tools that they use are simply not up to speed, or in fact counterfeit, are not what they're supposed to be, are billed for, then you're going to have an outcome that's simply not going to be good. And at the worst case scenario, an outcome that's devastating. Okay? So if you have counterfeit hardware, which has happened, surgeons have implanted counterfeit hardware, completely destroying people's lives. If you have counterfeit medicine, counterfeit drugs, okay, those could be both, your illicits and illegals, which everyone knows about. But what people aren't aware of are your pharmaceutical grade drugs that are actually dispensed, through what people feel are legitimate outlets. Drugs that are supposed to be made exactly the same as their brand name equivalents, and they're not. We see outcomes already that are incredibly variable. Literally today, ironically, just today, received a message from my office that a medication that a patient was given this month was a different brand, and it is completely and utterly not giving the patient a satisfactory result. She has been on this medication for years, stable for years, and all of a sudden she finds herself taking twice as much as she's supposed to take, and she's running out. And this creates a huge problem because now it appears on the surface, if you don't really know what's going on, it looks like, boy, is this patient a drug addict? Is this patient a drug seeker? Is this patient selling her medications? What is she doing with her medications? If we try to help her out, are we bad now for trying to help her out? Are we enabling her? Well, no, none of that's actually true. What is happening is the pharmacy, in order to save a penny, has switched to a manufacturer that has obviously standards that are below what they should be, and is making a medication that is clearly not the same as the brand name equivalent. And by definition, that's a counterfeit. Unfortunately, it may be a legal counterfeit. It may be legal. And this is what is so troubling, that currently in America, we have legal counterfeits. We have people taking medications that the physicians and the patients think are the real thing. And when you say 10 milligrams, they think they're getting 10 milligrams, and they think that that filler is something that's been widely studied in all of the clinical trials. And the reality is that's not necessarily what they're getting. And they're not getting the clinical effect that they think that they're supposed to get. And this can put a lot of lives in jeopardy. And we are so far away from widespread education. We are completely disconnected from any type of solution right now, because there's more money in counterfeit medications than there is in doing the right thing.